Hi there! If you just had a baby, don't you ever wonder what exactly your doctor is looking for when they do your baby's first physical exam? Hi, I'm Dr. Peter, I'm a pediatrician, and today we're going to go over exactly what parents need to know about their baby's physical exam from head to toe. Let's get started. I would like to introduce everyone to our wonderful patient today. This is Tina. Everyone say hi, Tina. So Tina is going to be our role model, and you can use your own baby at home to follow along. So you'll find that a pediatrician can do things in many different ways, but I like to take a head to toe approach because then I make sure I go through everything. So starting off with the baby's head, one thing that we always make sure that we feel is this soft spot at the top of the baby's head. That is completely normal. It might feel a little squishy. Just be prepared for it. That area is supposed to be open. The skull yet is not fully formed for a baby, and that is actually a good thing. So when they're being pushed out the vaginal canal or during a C-section, we could be a little bit rough to try to get the baby out, and it doesn't affect their brain because everything is still malleable. It will close within the first year of life by 12 to 18 months, but it's supposed to be nice and soft, not fully engorged, and not depressed. So that is the anterior fontanelle or the squishy spot. There's also a squishy spot on the back, the posterior one, that closes between 1 to 2 months, but same concept. This is also helpful because if you find that your baby was born and has more of a cone head, or their head is not perfectly symmetrical, we want to have them sleep on different sides of their head because that creates that rounded shape. And also, we'll talk about it in a second, but tummy time is also really good. If a baby has a flat head in the back, then you want to put them on their belly sometimes so that they can be stimulated. You talk to them like this, you help them lift up, and you're giving them the opportunity to build their upper back and neck muscles and stretch so they're not spending as much time on their head. We'll get into that in a little bit. Babies' eyes are sometimes open, sometimes closed, but what we like to look at is the color of their irises. Their irises are most likely bluish gray at this point, and they'll declare their full eye color by about 6 months of age. We use a special tool to look inside the baby's eye to make sure that everything has been formed properly. The baby's eyes are still developing though, so they can only see if you've seen my other videos on the channel, especially my inside out reaction, we talked about how when baby Riley was born, she can only see about 8 to 12 inches away from her face. So we like to be like, hi sweetheart, hi Tina, how are you doing? But she can only see in the colors of black, white, and gray, and she will get color as her eyes continue to develop over the next couple of months. Next, we're going to move down to Tina's nose. Babies are obligate nose breathers, which means that they have to breathe from their nose. This is helpful because a baby is going to be feeding from their mouth, either from the breast or from the bottle. So if they're feeding from their mouth, they're still able to breathe simultaneously through their nose, which is why it takes a while for babies to train and become accustomed to breathing, sucking, and swallowing simultaneously. It's a lot of coordination. And if they happen to be congested, which we talked about in our RSV video, you have a suction bulb or automatic aspirator, and you just put it at the nostril and suction out the boogies. Throw them out, maybe not onto your floor, but into a towel, and you suction out from the other nostril. You can use some saline drops like we talked about. You can check out that video, I'll link it down below. We're gonna talk about the baby's neck. So the baby, like we talked about before, should be able to turn their neck both sides. So the doctor will be checking, especially if the baby was large for gestational age or a bigger baby. And we like to make sure that the clavicles are fine and that there was no issue. If the baby is having difficulty turning to one side, then we are concerned about some tight neck muscles in that area. So we just encourage some gentle stretching the opposite way, massaging that area, and then not forcing it, of course, because you can cause some issues, but just gently rotating the baby's head. Then my favorite part is we like to count the fingers. This part is so cute because whenever I do it in the hospital with a baby, the parents are like, oh shoot, we didn't even count the fingers. So I always go, and Tina, let's see how many fingers you have. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, yay! And so babies have reflexes, which is a really cool thing. If you put your finger inside their hand, they will automatically grasp your finger, which is their Palmar reflex. It's a grasp reflex. And I use it to feel their reflex. Then I also lift the baby up to feel their strength, and then we let go. Now, different pediatricians do this differently. Some hold the baby up and then let them drop a little bit. It is a startle reflex. We're checking to see that the baby does something called a Moro, where they try to like grasp out and their hands open up. I just use it as a gentle lift and drop, and then their hands open. Then we work our way down. So we look at the baby's chest. We want to make sure that there are no rashes. There are a lot of normal newborn baby rashes, but we like to look at the chest, and then we look at the side, at the side, wonderful. We look at the legs at the same time. For any medical trainees who are out there, we have to check the Ortolani Barlow. For any parents out there, we're just checking the hips to make sure that they developed correctly so there's no hip dysplasia or the kid doesn't have any of the joints locking out. So I go in a circular motion like this, and babies kind of like it because it helps them release gas. This is also the bicycles that some parents talk about with babies to help them pass some gas if they're feeling crampy. Want to put some inward pressure on the hips and some outward and forward pressure and feel if the hips pop out. For some babies they do, and so we get ultrasounds. It's a whole workup that we do, and sometimes babies have to be put in a harness to help their hips develop, but most babies have their hips developed perfectly fine. Then you come down to the legs. I pull the legs to make sure that they're symmetrical. For this camera, hi, how are you doing? You can see that baby Tina was born symmetrically, which means she was symmetrical in the womb, in that she has the same creases on both sides of her legs. This is the Dr. Peter special. I teach all of my students this and the parents love it as well. I call it the high bye. If you put your thumb in the baby's toes, they will also grasp just like they do with their fingers. It's kind of really cool. They do a foot grasp of you. And then if you stroke the outside of their foot, like it's a Babinski for any trainees, but if you stroke the outside of the foot, they fan their toes. So they grasp and then they fan. So I call this the Peter high bye. So they come and grasp you and they say, hi, how you doing? Then you stroke the outside and they say, bye, and they fan their toes out. It's very cute and the parents love it. Then of course we have to check the diaper area. This is a doll, but for males and females, we have to check the diaper area, make sure that one, they're peeing and pooping. If there's a poop diaper, we help the parents out and we change it, but we also have to check femoral pulses, and then we make sure the baby's the heart is pumping blood all the way into the femoral area. If it's a male, that they have both testicles, they're both descended. If it's a female, there's sometimes some vaginal swelling or vaginal discharge, all normal things. It's just mom's hormones, but if you're concerned, please talk to your pediatrician. Again, poopy diaper, we help the parents out and we say, Mom, you delivered the baby. Dad, you're on diaper duty. Then we like to take the baby, always support the neck, and roll the baby onto their side. And when they're on their side, we lift the shirt up to take a look at the spine. We feel the full spine all the way down. There's no drops or divots. And then we check in the sacral area to make sure that there's no sacral dimple. Tina does not have a sacral dimple. She has a sacral stitch because that's where she was stitched together, but we look for sacral dimpling. So this is a qualifier, an asterisk. Babies' physical exams can go in many different ways. If they're crying, you kind of want to listen first, but because Tina's being cooperative, I know I can listen to her last. So I did all the physical things with my hands, and now I'm going to use my stethoscope to listen to her heart. So we like to do it directly on the skin. I swear I thought I heard a heartbeat. I think I'm so tired. And then we listen to her lungs on both sides. Then we listen to the belly. Excellent. But you could start with the heart and lungs if the baby is sleeping. We do it in different ways, but as long as you get to everything. And then babies also have umbilical cords. Tina does not. The umbilical cord itself will fall off on its own over the next couple of weeks. You do not need to do anything to it. Do not put alcohol. You don't need to do any special creams. It will fall off naturally on its own. Until it does, sponge bathe your baby. You cannot submerge them in water, again, because we want to keep that area nice and dry. But since we talked about the umbilical cord, I'm so happy that now we get to talk about tummy time. So when it comes time to changing your baby, they're already naked, you got them on a fresh diaper, then you take them and you put them on their belly. But you want to be mindful that they can get tired pretty quickly. So the reason we do it while they're naked or while they have a fresh diaper and you can see a majority of their body is we're checking to see that they don't get tired. So you want to put your baby kind of like the Sphinx with their arms next to them, and then maybe her head would be on the side, but you come and you say, hi Tina, how are you doing? And she wants to lift. You want to lift, but you're taking a look at her body the whole time, and if she starts to get tired and drop, that means she's a little too tired. You lift her, flip her back over. In the beginning, she should only be doing 5 seconds. If she could do 5, next time challenge her with 6 seconds, 7. If she can only do 3, flip her back over. You're just trying to help her strengthen that neck and upper back muscles, because this will also help her, again, with the shape of the head, we talked about that, make it nice and round, and it helps her reach one of her developmental milestones, which we will talk about in another video, but I want to give you a sneak peek that the reason why this is important is because if your baby continues to practice tummy time and gets good neck and upper back control, then your pediatrician can give you the okay and the approval to start solid foods. We are looking to see that a baby can control their neck and upper back when held up to start food, because if they still have a flimsy neck, there's a risk that they could potentially aspirate. So we look to see that a baby can hold their neck up at the 4-month visit, and if they can, bravo, she can start solids. If they can't, then we just wait until the 6-month visit. So by starting tummy time now, you help her reach her developmental milestones sooner. We'll talk about all the developmental milestones in another video. I'll link it down below once that's out. But that is a physical exam for a brand new baby. There are a bunch of other things, of course, like tongue ties and specific rashes. Your pediatrician will talk to you about those and what to do with them. That concludes our physical exam for our friend. Thank you, Tina, so much. Round of applause for Tina. Let me know what you found most exciting and most intriguing about your baby's physical exam. If you followed along with your own baby, let me know as well. That's so sweet. And I'll see you in the next video where we're going to learn how to swaddle Tina. What do you think, Tina? What do you think of that? Is that a good idea? I think she likes it. All right, y'all. We'll see you in the next video, which we'll link right here. Bye. Oh, what'd you say? She said send it to a friend, send it to a loved one, and share it with your baby. Ciao.